So, if you're here to learn more about what non invasive regenerative therapy is, or how it can help with your chronic pain, or even help you heal faster to get back to doing your activities at a much quicker rate from something that has been very recent, we're going to kind of show you, some different examples of people that we've seen with fantastic results. So, stay tuned. This is going to be amazing. So a little bit about like our mission, our number one goal is to help you avoid surgery, injections, and medications. And we do this by also helping you get back to your life, like giving you hope that it's possible that you can do the things that you love to do, get back to the things, being active, playing with your kids, your grandkids, playing sports, those kind of things as we get older. It's possible. I'm in that category. I'm about to turn 50. And I'm always trying new things and different things to help me stay active. So that's my goal, and for myself as well as for my clients. A little bit about me. So I've had over 20 years of experience in physical therapy, and during my journey I've had a lot of different health issues and conditions, and the biggest thing for me was I always knew that my body had an amazing ability to heal if I gave it the right environment. And that could be from a holistic nutrition type environment. It could be from a physical therapy environment. That our bodies have an amazing ability to heal, and we don't have to go through surgeries and procedures and take medications and all these things. And I've done it, and I've stood by it, and I've tried to find more education information, not only for myself but also through other medical professionals out there that I've partnered with on really just trying to help not only me but also my clients, just really live their best life, like really just live it. So I've been in this wellness industry and have been searched for a really long time. I was a top collegiate soccer player, made it all the way up to the U.S. national soccer team pool. So when I talk about the abuse of my body, yes, it has happened. I've been playing sports since I was 2 years old. And I can tell you my right knee is not great. But I don't want to have surgery. And I actually wish I never would have had one of my surgeries. And I wouldn't have if I knew what I know now back in the day. I also have my diploma in mechanical diagnosis and therapy, which is only 400 worldwide people that actually have that. And really, that's just helping us, diagnose from a mechanical perspective, like looking at the whole body to figure out where the source is kind of coming from. I strive to continue my learning so that I can then share that with everyone else. So, could you imagine what it would feel like if you could find a solution to your chronic pain or heal quicker? What would that look like? I want you to take a moment and just think about that. What would that actually look like if we could actually help you with that? And we've had many of clients that have walked through our doors and said, they lost hope until they came here. Now they have hope for the first time, and they're actually doing really well, and is amazed at what they're able to do that they never thought that they would be able to do. So just kind of think of that. So what you're going to learn today, we're going to learn a little bit about shockwave therapy, which is that non-invasive regenerative therapy, how it helps with chronic pain as well as acute injuries, and what are some of the common conditions that it does help. So we can just kind of think about that, and why we added it and why it's kind of helped our clients. So what is shockwave therapy? Shockwave originally was found to blast out kidney stones non-invasively, which is pretty fantastic. And so it is a non-invasive regenerative treatment that uses high energy sound waves to stimulate healing and reduce pain in chronic orthopedic conditions. It also kind of re-injures and promotes healing again on those degenerative tissues. So a lot of times, when we've had things and we've done repetitive things to our body, whether it's a tendon or a muscle, it can become degenerative in the sense that it no longer is healing, and it's not bringing in blood supply, and it's just there. Like, you can try to do soft tissue, you can try to do all these things, and you can help it through exercise, but you can do it much faster through shockwave on really just getting that tissue to kind of break up and bring in that blood flow, bring in the collagen to help strengthen the tissue to really get you back to like, wow, I actually can move through this muscle and it doesn't hurt anymore. And so that's kind of one of the things that it does. It also removes calcifications that get reabsorbed into the lymphatic system. So a lot of times we can get some pulling on bones or extra pulling in areas, we'll get some calcifications in and around the joints or the tissues that creates problems. And so this can knock those out and have it reabsorbed into the body. It also promotes new collagen production, which helps strengthen the fragile tissue and speeds up the healing. This is huge. This is going to make that tissue much stronger. And it can reduce inflammation by reducing the inflammatory cells in the area. So when you have something that is acute, it's amazing what it can do to start knocking out some of the inflammation and the damage to the tissues at a much faster rate. And we're going to talk more about that. It also increases blood flow, which helps bring nutrients, oxygen to the damaged area, and it breaks up scar tissue and adhesions, which often can happen as we get older. We tend to use our muscles, and maybe we've been compensating using something that we shouldn't be used the way we did, the way we've been using it, or we just haven't slowed down. That's my case. I don't ever want to slow down, so I'll still push through it and still do it, knowing that I probably shouldn't be out there doing some of those things because it's going to hurt my body. But I'm just like my patients, just like my patients, in the sense that I don't want to stop. So I don't until something happens to where you're like, if you don't stop, you're going to really do some damage. So it can really break up some of those scarring and adhesions, which is, I'll kind of share my story in a second. So what does all this mean to you? So often as our tissues, as we age, they either can get inflamed where it's kind of like a tendonitis. So we can see a picture here where the tendon is just a little bit more inflamed and irritated, or it'll become more degenerative where there's no more healing that's happened, leaving these conditions chronic. And what we find at times is that, yes, while we help some of our clients and they're moving so much better, everything is working, but they still get that tightness or that soreness, and they don't fully resolve. We've been able to use this for that reason. So like they've had the issues for so long that the tissues around the area that's been hurting has been like that for so long that it's just kind of got degenerative. It stopped healing, and we're able to like use the shockwave to basically bring it back to life, then to get things moving so much better. That's what we've noticed in some of our clients. So this happens in muscles and tendons. So it's not only, just a tendon that this can happen to, it can also happen in muscles. So things like Achilles tendonitis, plantar fasciitis, muscle tightness around the joints, the knee joints, the back joints, the shoulder joints, your tendons in your elbows, those kind of things. So I'll share my story a little bit. So I've played sports forever and abused my body and still continue to abuse my body. And one of the things, I just didn't want to slow down, but my knee was really bothering me and it was really tight. And I had people work on it to get rid of all the tightness, and that definitely helped, but I still was having a hard time getting my quad muscle to activate, and I couldn't figure out why. I was like doing everything. So I was so excited when we got this unit. I was going to be the first person to kind of really give it a try and just see how everything works so that I would be able to better help my clients. So I started the shockwave, and instantly the first visit, which you will notice, you'll either get better or worse. Most people get better. If you get worse, it just means we have to adjust it. You've gone too hard. You need to let us know, because there's a happy medium on where we want you to be as far as feeling the tissue. And if you're too high, we're finding that it actually will make you a little, not, it doesn't really necessarily make you worse. You're just going to feel it a lot more afterwards. You aren't going to get that feeling of, wow, this is great. This is the best I felt in a really long time. So with that being said, I went and I could tell, my tissue was blowing up, all around the knee, on the outside, on the inside. And I worked it for 4 weeks, and every week it got better and better. And I was able to activate my muscles so much more, to where now I'm like able to squat low and do things, and I don't feel my knee. I actually feel my muscles firing, and I'm able to use them again, which is amazing, because if you can get the muscles to work and to like hold the joint, you're going to do better. Your joints are going to feel better because it's more of that muscle tightness. So I'm super pleased with what we've been able to do, not only for myself, but also for our clients. So another thing we can think about is frozen shoulder. And this is, gosh, if anyone's ever had frozen shoulder, it's something that takes a long time to heal from. It's a long journey. You've got to go through all the different phases. It's really more of kind of like an autoimmune type condition where the body's kind of attacking the shoulder. But we're finding that when we use the shockwave, because there's adhesions and different things around from that adhesive capsulitis, we're able to knock out those adhesions to speed up the healing so much faster, to get people feeling better so much faster from a frozen shoulder, which is amazing. And again, this is, one of the main reasons why we purchased this unit, was because we knew that we were going to be able to help clients in such a different way to get back faster, to feel better faster. And that's why we went ahead and purchased this. Again, elbow tendonitis, and one of the big things that we have found and learned, unfortunately, there's different heads for different parts of the body and different intensities, and we're playing around with that to get the best results. And when we first started doing the elbow, it was making people too sore, and so we've had to knock down how we do the treatment, and we're playing around with like the different numbers that we can play around with. I'm not going to get into it because you won't know what that means, but we do. And we're also using different heads to really make it where it's a lot more comfortable for that elbow. And we're getting fantastic results. Again, if you go too hard, too soon, too fast, you will hurt, and you'll be like, this doesn't feel good. And that's not good. But what we want from a response is we want you to either feel good or we want you to feel bad. Not that we want you to feel bad. We want you to feel something, because if you feel nothing, then it's not going to work for you. And that's just a good indication. Like if we don't get results on the first visit of some sort, then we don't need to be using this on you, which is great. So another thing, this is something that one of my PT friends has been doing and is actually doing a research study right now on it, is on MS, multiple sclerosis. So we're starting to see results with Shockwave, and essentially how we're using it is looking, matching up from the MRI where all the lesions are to using Shockwave in those areas. And we're able to help people get back to walking better, to having more energy levels, to not hurting as much. Some really fantastic results. And it's the beginning stages of doing some research in this area, because the results have been amazing. So I just kind of wanted to throw that out there because you may know someone that is dealing with something like this, and this would be a great opportunity for them to try something that really could have a huge impact on their life. So arthritis, is it really where your pain is coming from? I always ask this question because a lot of times, as we get older, we're going to show arthritis on the imaging. It's just what happens when we get older. Just like as we get older, we're going to have wrinkles on our face. Well, the arthritis is literally wrinkles on our bone. And so is your pain really coming for that? Or is there something else? And one of the big things that we've noticed is that we can really see, you can really get more degenerative muscles or tendon issues around the joints, such as the knee, creating the joint to feel very arthritic, very similar to my story. I mean, it kind of felt that way, and I knew it wasn't that way because we could move my joint and it would actually feel good. And I knew that it was more muscular related, that it's just, I'm not able to get any of those muscles to fire correctly. There's just too much degenerative tissue around that area. And we've been able to use this to basically get that tissue to be healthy again, which is amazing. And in a very quick pace. So like most of the time, people that come into our office, it's anywhere between 3 to 6 visits, depending on kind of what's going on. So it's not a lot of visits to start noticing that you're feeling better. And then when we get you feeling better, we've got to get to like, why was that tissue like that to begin with, and start working on getting you stronger and looking at your compensation patterns so that that tissue doesn't get like that again. So, oftentimes we only are spent, 10 minutes with a doctor, and they take a picture of your knee and they see arthritis. And so, it's one of those things that, you really have to sit down, have a conversation and look at the whole big picture. And a 10-minute conversation is not going to do that, which is why we typically get the diagnosis of arthritis so often in our medical system, because the doctors literally just don't have time. They do not have time. it's a numbers game. They have so many pressures on them, just like physical therapy, just like nursing. There's so many pressures to see more, do more, have more paperwork, that they just don't have time to spend with you. And that's a problem. And so, just like I said, just like we get arthritis as we get older, it's just like getting wrinkles on our face as we get older. There's no harm. We do get them. It's just part of aging, and the wrinkles on our bone is just a part of aging. So, arthritis may really not be where your pain's coming from. So I really want you to take this as like, oh, wow, that's great. I have hope that I actually can get better, and that I don't have to have surgery or constantly have injections to get my knee to feel better, to get my ankle to feel better, to get my elbow, shoulder, neck, back, whatever it is for you to get better. So one of the big things that we've noticed is better muscle activation after Shockwave. So we have a client who had a really, really, really bad knee and was like, had her knee like that for a while, was wearing a brace, still trying to be as active as possible, and finally end up having a partial knee replacement. And when she got to her office, and this was like 6 months after the surgery, and she still was having a lot of issues and not able to walk, and was just really frustrated. And I was like, dude, like, you have no muscle. There's no muscle activation here. You haven't had muscle activation here in years. And you've had this brace. Let's go and do a little bit of Shockwave. Let's see what we get from a tissue perspective, and then we've got to get you stronger. And so literally, where the brace was hitting her, she created a lot of scarring or adhesions or things from that brace just rubbing up on her muscle, that we got that to break up. And so, the first visit, we went and gave her some exercises, and it was really hard to get her muscles to activate without her knee hurting. And so we found some, and she was able to do it. We went, and a week later did her second visit. And I kid you not, I'm shocked at what she's able to do. Like, she's able to do a single leg squat, and it doesn't hurt her knee, and she can feel it in her muscles. Like, that never would happen without the Shockwave. You just get better muscle activation when you use it. And so she's going to be progressing much faster through everything, and feeling better quicker by using the Shockwave therapy as a part of her treatment, as well as getting some of those adhesions and calcifications or scarring that's happened in that tissue from wearing that brace. But yeah, like I was like, holy cow, I can't believe what we can do in 2 visits, when this quad couldn't even fire. We couldn't even get it to activate the last visit. It was really hard. So that's amazing. Does not happen that fast. So it also speeds up healing. So like, if you have an injury that's very recent, let's say you have something, whether it's a vacation or a race or an athletic event coming up, from a recent injury, we can speed up the healing by around 50%. Pretty amazing results. And we'll share a story of someone here in a second that had a massive calf injury, and what she was able to do just after one visit with the Shockwave. So that's something else. This is not just for chronic tissues, but it's also for those recent issues, to really help with that inflammation and getting the body, bringing the blood flow and the collagen reproduction, so that we can get that tissue stronger faster. So here's a testimonial. This is an SMU swimmer who had chronic back pain. And we had been seeing him for a while, but he had been to many different healthcare providers, and was actually getting worse in his back. And we found him, or he came to us, and we started working on him, and he got through a season, was doing really well, for the most part, but still was getting some soreness, like the soreness after the games. It just take him longer to recover from his treatment. So we got the unit. I'm like, oh my gosh, come in, let's do the Shockwave. And so this is something that he did. Here's his story. It's about a minute long, on how the Shockwave helped him.
I've done exercises and everything, and she proposed that we do Shockwave, and so we tried it. And after the first week, like just the first week alone, I already started to like see differences, because usually after like a kick set and swim practice, like I usually can't complete it, and the next day I'm like dead. Yeah. But like the Shockwave, like just after 1 week, my practices with kick practices, like I was able to last longer. And then afterwards, like I just did a few presses and I was all good again. So, Shockwave, I loved it. And yeah, it was only 4 weeks, 4 procedures. And basically like I'm pain free. Like this is the best I've been. So caffeine, I've done it.
So we want this to kind of give you hope that it's possible to feel better. It's really common for our clients to see 7 to 10 different healthcare professionals before coming in and seeing us. So like we're like their last resort. And honestly, we just want to give people hope that it's possible, that they can get back to feeling better. And this is not to say that we don't send people to surgery and that we're so against it. We're not. But we've been able to save way more people from having surgery than to have surgery. And there's times when surgery is needed. We had a patient recently with back issues, and she just wasn't progressing the way she should have been progressing, and it actually was kind of getting worse, which was very unusual. And I was like, yes, let's go and get this checked out. And sure enough, um, she had a cyst, a pretty big cyst on her back from a fall that had happened. And that's what created that cyst. And she had to have surgery to take it out. I mean, so there's times when we definitely need surgery, but typically we only send 2 or 3 people to surgery per year. And we have, almost 4 physical therapists treating full time. So literally that's huge. That just should give you hope that it's possible that you can get back to feeling better. So why are you here? You showed up today, even though you're incredibly busy for a specific reason. You're listening to this for a specific reason. And I want you to think about, what that is, and kind of go from there. And, we always have people ask us, are you sure you really can resolve my pain? I've tried everything and nothing has worked. And so, yes, we've seen a lot of things, and we're honest with you if we feel like you need to move on. And we look at the whole body. I mean, it's not just a, physical therapy that we look at. I mean, we also look at the emotional component. We also look at, autoimmune type conditions. We can tell when someone needs to be referred out and have places to refer people out so that they can get the results that they want to get. So this is another testimonial. We had a firefighter that came in, and she was playing volleyball and like went and landed and tried to push off and had a massive calf tear. So literally her, you could still see the bruising on her first visit when she came in. It was black and blue and pretty bad. So we did a one treatment initially for the shockwave, and literally we get a picture from her going, I was able to fight a fire after one treatment, literally like carrying things up and down stairs. And was terrified that she was going to re-tear it. And she didn't. She was a little sore, but it wasn't bad. She was able to kind of do her job. And that was her biggest fear, was that they were going to have some massive event like this that she was going to have to go to. And her calf wasn't going to be fully resolved, and it wasn't fully resolved, but way, way, way better with one shock treatment. And by the second shock treatment, she was feeling 90% better. We have people with plantar fasciitis that literally, like, we had a lady who's tried everything. I mean, she's been hurting for over a year, from different orthotics to injections to booting to physical therapy, to doing massage therapy, like all these things, and not getting the resolution. And after one treatment, she was like, oh my God, I feel 50-60% better. That's amazing. The best results that she's had. And her tendon that was so tight, her plantar fascia was so tight, literally like released and was like way more flexible. Even after the first visit, it's quite remarkable. So what we want you to do is kind of check out some of our other resources. We have so much that we do and provide education with, because that's our goal, is to give you education. And we have some free ebooks on neck and shoulder pain, back pain, knee pain, TMJ, pelvic floor, all these things, blogs, podcasts, video testimonials. You can find these resources on our website, www.empower-pt.com. We post all of our podcasts on our website, but we're also on Apple and SoundCloud. So definitely make sure that you like us, so that you can get all of our great education that we like to provide.